Thanks for joining us today. My name is Dr. Kyle Gullidge with True Health, and this is 3 things you need to know before you choose your chiropractor. So the first most important thing is that pain is a symptom of a condition, not a diagnosis. And this is why a lot of people can get frustrated and not get the results that they want, is they're trying to treat a condition as opposed to understanding and treating the proper diagnosis. Now, in our studies, we understand that diagnosis is absolutely key, and we are in the process of going through a fellowship through the University of Buffalo's medical school. Now, this is just a fantastic school, and it's really teaching the cutting edge principles and techniques of diagnosing. The things that we have been taught are literally changing the face of how spine care is diagnosed nationally. So I'm going to walk you through some of this. This is an example of an x-ray of one of our patients. This is a hip. This is another hip. This is the tailbone right here, and these are the spine bones stacked at L5, 4, 3, 2, and 1. Now, you don't need to know the anatomy, but there is some really important things you need to know. That one spine bone, it's called a vertebra, and the spine bones need to be balanced. So if we draw a line from this side to the front and this side to the front, these lines should be the same length, obviously. Now, when we look at it in a little more three-dimensional way, we should be able to draw a line from this side to the front and this side to the front. And these two lines need to be the same. Now, if these lines aren't the same, that means the spine has begun to rotate in one area. Now, we're going to actually overlay the same x-ray. Now, background in this patient, he had had pain for over 7 years and had to stop doing a lot of the things that he really wanted to do, like golfing. And he had tried medicines, he tried physical therapy, he tried chiropractic, but because he didn't have the right diagnosis, he was frustrated and left not getting results. So when we draw these lines, like we were talking about over here, when we draw the lines from the side of the vertebra to the front, we should get us the same distance. In this case, there's 1 millimeter difference, not a big deal. Another 1 millimeter, another 1 millimeter. Now look down here. 4 millimeters of rotation and 8 millimeters of rotation. His spine is mechanically distorted. This is causing his condition. This is causing his pain. So this method of analysis lets us know exactly what the diagnosis is. And really, this is a lot like a microscope for the spine. It's really changing the way diagnosis is rendered. Now, number 3, the treatment must be right for the diagnosis. If we know exactly what's wrong with the spine, then we can use these very specific and gentle adjusting instruments to put the spine exactly back where it's supposed to be, whether it's an electrical one or a manual one. We also do acupuncture, and I know some people can be afraid of needles, but acupuncture is a very, very excellent way to help fix the spine. And the last thing is physical therapy. So the combination of chiropractic, acupuncture, and physical therapy paired with the right diagnosis gets people the very, very best results. So make sure you go to the bottom of this page, register below to schedule your consultation and start feeling better today. You deserve the best results.